Sjogren's is not cancer. I need you to hear that first because I don't ever want to be the reason someone lies awake tonight terrified. But here's the thing nobody tells you when you get that diagnosis, and it's the thing I think every single person with Sjogren's deserves to know without having to dig for it. Sjogren's raises your risk of one specific cancer, a slow-growing lymphoma that starts in the same glands that are already inflamed and struggling because of your disease. And the wild part, the part that made me want to make this video, is that the earliest sign of it can show up in the same mirror you're already looking into every morning when you check your dry mouth, your dry eyes, your swollen glands. You've been staring at the evidence this whole time. You just didn't know what you were looking for. So today I want to walk you through this the way I'd walk a friend through it. Not a lecture. Not a scare. Just the actual pattern, what's normal Sjogren's puffiness and what's a sign that deserves a phone call. Because early detection here is not a maybe, it is everything. And you are the only person who sees your own mouth, your own glands, your own neck every single day. Your rheumatologist sees you for 15 minutes every few months. You see you every morning. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. And if you want the full Sjogren's symptom map guide with visuals, symptom breakdowns, and additional resources, type symptom map in the comments, and I'll send you the link to access it. Let's talk about why this connection exists in the first place, because I think understanding the mechanism makes the signs make sense instead of feeling random. Sjogren's happens because your immune system has decided your own moisture-producing glands, mostly your salivary glands and tear glands, are the enemy. Your body sends immune cells in to attack them, over and over, for years, sometimes decades. And here's the thing about chronic, relentless immune activation in one tissue for that long. Every so often, in the middle of all that immune cell traffic, a cell divides wrong. A mutation slips through. And because that tissue has been a war zone for so long, the environment is unfortunately fertile ground for that mutated cell to survive and multiply instead of getting cleared out like it should. That's the oversimplified version of how a slow, low-grade lymphoma called malt lymphoma can start growing quietly inside a gland that's already swollen from Sjogren's. It's not a separate disease that comes out of nowhere. It's your own glands, the ones already under siege, eventually producing something that needs its own treatment. I want to be really clear about scale here so nobody spirals. Most people with Sjogren's will never develop this. The numbers researchers cite land somewhere around 5 to 10% of people with Sjogren's developing a lymphoma at some point during the course of their disease, and it tends to cluster in people who've had certain warning signs for a while, which I'm going to walk you through. This is not a coin flip. This is not something that happens to most of us. But it is common enough, and quiet enough in its early stages, that knowing the signs matters. If you've read this far and you feel a knot in your stomach, that's your body asking to be taken care of, not a prediction of what's coming. Keep that in your chest as we go through this. The first thing I want you to understand is the difference between the puffiness you might already live with and the kind of swelling that's actually a signal. A lot of people with Sjogren's have parotid glands, the ones that sit right in front of your ears and along your jaw, that come and go with swelling. Some mornings you wake up and your face looks a little fuller on one side. Stress flares it. A bad night's sleep flares it. A salty meal flares it. That kind of swelling that rises and falls, that responds to your flare pattern, that's usually just Sjogren's being Sjogren's. What's different, what deserves attention, is swelling in that same gland that doesn't come and go anymore. It just stays. It's there in the morning, it's there at night, it's there next week, and it's usually just on one side, not both. If you press on it, it can feel firmer than the usual soft puffiness, sometimes almost rubbery or like there's something solid underneath the swelling rather than just fluid. Here's a detail that trips a lot of people up. Sjogren's flares of the parotid gland tend to be tender, a little sore when you press on them, especially during an active flare. The swelling we are talking about here tends to be the opposite. Often painless, or close to it, even though it's firm and persistent. That combination, firm, painless, one-sided, and sticking around past a few weeks, is different enough from a normal flare that it's worth describing exactly that way to whoever you call. Don't just say my gland is swollen, they already know that about you. Say it's swollen on one side only, it hasn't gone down in weeks, and it doesn't hurt the way my flares usually do. That specific description is what actually gets you an ultrasound instead of a shrug. Another detail worth knowing, This kind of swelling can sometimes show up under the jaw instead of in front of the ear, in what's called the submandibular gland. Same rules apply. Compare both sides. Note whether it rises and falls with your flares or whether it's simply been there, unchanged, for a stretch of time you can actually name. If you can answer the question how long has this been like this with a specific number of weeks instead of I'm not sure, that's usually your answer about whether it's worth mentioning. If you've noticed one side of your face just hasn't gone down in a while, I want you to hear this clearly. You didn't imagine that. You've been living so closely with your own flares that you know the difference between your normal puffy morning and this, even if you've been talking yourself out of it for weeks. That noticing is not anxiety, it's expertise, the kind you only get from paying attention to a body other people don't understand. Type the word gland in the comments if this is you. Not because anything gets sent your way, just because saying it out loud is sometimes the first step toward finally making the call, and you deserve to feel a little less alone in noticing it. The second thing to watch for is something a lot of people with Sjogrens already brush off because dry mouth makes everything in there feel a little off all the time. That's sores that don't heal on the normal timeline. If you bite your cheek, if you get a small irritation from a dry patch rubbing against a tooth, that should heal within a week to 2 weeks like it would for anyone else. What's different is a sore, an ulcer, a raw feeling spot that sticks around well past 2 weeks, especially if it's not painful the way a normal canker sore is. That painless quality is actually one of the sneakier parts of this. We are wired to worry about things that hurt and to dismiss things that don't. But painless is often exactly the profile of something that's been growing slowly rather than something that just happened and is actively irritated. There's a second layer to this one worth knowing. Location matters. A sore on the roof of your mouth, on the floor of your mouth under your tongue, or along the side of your tongue tends to get watched more closely than a sore on the inner lip, simply because of how those tissues are structured. That doesn't mean a lip sore never matters, it means the ones underneath and to the side of the tongue deserve a slightly faster call if they are not healing. It's also worth checking whether the edges of the sore feel raised or rolled compared to a normal ulcer, which usually looks like a flat little crater. A raised or thickened border is another detail worth mentioning out loud rather than keeping to yourself. So the sore that doesn't hurt much but also doesn't leave, that's the one that gets a second look, not the one that stings for 3 days and fades. If there's a spot in your mouth you've been quietly watching, telling yourself it's just another dry mouth thing, I want you to give yourself credit for even noticing it's lasted this long. You know your own mouth better than any calendar reminder ever could. That patience you've had with your body, the way you keep tabs on things instead of ignoring them, that's not something to feel silly about, that's care. Type the word sore in the comments if this sounds familiar. You are allowed to take something seriously even when it doesn't hurt. Third, and this one is easy to overlook because Sjogren's mouths already look different than other mouths. White patches. Not the kind that come with a sore throat, not the kind tied to a known infection you're already treating, but a patch of white on your gums, the inside of your cheek, the sides of your tongue that you can't explain and that doesn't wash off when you rinse or brush. Sjogren's dryness can sometimes cause a condition called leukoplakia, which on its own is usually benign, just a thickened patch from chronic irritation and dryness. But leukoplakia in a chronically inflamed mouth is also one of the patterns that gets watched more closely precisely because it sits in that same at-risk tissue. Something else worth knowing about this one. Texture matters as much as color. A patch that feels smooth and flat under your tongue is generally lower concern than one that feels rough, bumpy, or slightly raised, almost like it has a texture your other cheek doesn't have. Try gently running your tongue over it, not to diagnose yourself, just to have language for what you're describing to a provider. Does it feel like a callus? Does it feel like nothing at all? Does it feel thicker than the surrounding tissue? Those details help a doctor triage how quickly to look at it. It's not that white patches mean cancer. It's that a new, persistent, unexplained white patch in a mouth that's already dealing with years of dryness and immune activity is worth a look rather than a shrug. Living with a mouth that already looks and feels different every day is exhausting in a way most people never have to think about. So if you've spotted something new in there and hesitated to mention it because you didn't want to sound like you're overreacting again, I see that hesitation, and I want you to let it go. You are not overreacting. You are the one person who actually knows what your normal looks like. Type the word patch in the comments if you've been sitting with this one quietly. You deserve an answer, not just a guess. And along the same lines, fourth, red patches. These actually carry a bit more weight than white ones in general oral health, and the same logic applies here. A red patch that shows up and fades in a few days because you burned your mouth on coffee, that's nothing. A red, slightly velvety-looking patch that just sits there, doesn't hurt much, and doesn't have an obvious cause, that's the one you bring up at your next appointment, or honestly, don't wait for the next appointment, that's the one you call about now. A useful thing to track with these is whether the patch is flat or slightly raised, and whether it bleeds easily if you brush near it or bite it accidentally. Easy bleeding from a patch that otherwise doesn't hurt is another detail that's genuinely useful to mention, not because it's automatically serious, but because it's specific information a provider can act on instead of a vague "this looks weird." Take a photo if you can. Lighting changes, angle changes, and memory is unreliable, so a photo from today compared to a photo in 2 weeks tells you far more than trying to remember whether it's grown. If this is the sign that made your stomach drop a little, take a breath with me. Noticing something and acting on it are two different acts of courage, and you're already halfway there just by knowing what to look for now. You've carried this disease long enough to have earned the right to trust your own instincts about your own body. Type the word "red" in the comments if this one landed for you. Naming it doesn't make it real, it just makes it yours to handle instead of something you're carrying silently. Fifth, and this is the one I really want to land, because it ties back to the whole reason this video exists. A new lump. Not the familiar glandular swelling you already live with, but something new, something you can feel with your fingers that wasn't there a few months ago, whether that's in the parotid gland by your jaw, under your chin, or in the lymph nodes down the sides of your neck. Sjogren's already comes with some lymph node activity sometimes, your body is in a heightened immune state after all, but a lump that is new, that keeps growing rather than staying the same size, and that doesn't come with an obvious infection like a cold or a dental issue, is the single clearest version of the sign we are talking about today. A few details that help you describe this accurately if you find one. Is it mobile, meaning does it move a little under your fingers when you press it, or does it feel fixed in place, stuck to the tissue underneath? Is it soft or firm? Is it tender when you press it or is it painless? Generally, a tender, mobile lump that shows up alongside a sore throat or a cold is your body's normal lymph node response doing its job, and it usually shrinks back down within a couple weeks once you're better. A lump that's firm, not especially tender, doesn't move much, and shows up without any obvious infection alongside it, especially if it's been growing rather than staying the same, is the version worth getting imaged. This is the one that turns into an ultrasound. This is the one that turns into a biopsy if needed. And I say that not to scare you but because a biopsy that finds nothing serious is a good outcome. A biopsy is not a diagnosis, it's information, and information is always better than a guess. If you felt something new under your fingers this week, I don't want you to sit with that alone tonight. You have spent years learning your own body's language while doctors were still learning to believe you, and that makes you more qualified to notice this than almost anyone in your life. Type the word lump in the comments if this is the one you've been feeling but haven't said out loud yet. You are seen, and what you're noticing matters. Sixth, changes in your voice or your swallowing that don't have an obvious cause. Hoarseness that isn't from yelling at a game or from a cold, that just lingers for weeks. Or swallowing that starts to feel different, especially with liquids before food, which surprises people because we assume solid food would be the first thing affected. Coughing when you swallow liquids that didn't used to happen. A sensation that something is catching or pooling when you swallow rather than going down smoothly. In Sjogren specifically, these symptoms get tangled up with plain old dryness, because dry throats already make swallowing harder and voices already get raspier without enough moisture to lubricate things. That's exactly why this one gets missed the most. People assume it's just more of the same dryness they already have. The distinguishing detail is a change from your own baseline. Not dryness you've had for years, but a shift, a new difficulty, a new catch, a new rasp that's different from the dry voice you've adjusted to living with. One more thing worth noting, if the hoarseness or swallowing change seems to sit on one side more than the other, meaning food or liquid seems to pool or catch consistently on the same side every time, that lateral pattern is worth mentioning specifically, because one-sided symptoms in the throat point providers toward looking at a specific area rather than searching broadly. This is often the quietest sign of all, the one that's easiest to explain away because dryness has already changed your voice and your swallowing for years. But you know the difference between your normal dry rasp and something new, even when it's subtle. Trust that. Type the word voice in the comments if something about how you sound or swallow has shifted lately. Some changes deserve a gentle mention, not a dismissal. There are two more signs I want to add, because they don't show up in the mirror, they show up in how you feel, and they're just as important as anything visible. The seventh sign is what doctors call night sweats, meaning waking up with your sheets or your clothes soaked through in a way that isn't explained by your room being too warm or a blanket that's too heavy. This is different from the general overheating a lot of Sjogren's bodies deal with, or a single hot night. It's a pattern, night after night, drenching enough that you have to change your clothes or your sheets. On its own, night sweats can come from a dozen harmless things, so this isn't a sign to panic over in isolation. But paired with any of the other signs we've talked about today, a lump, a gland that won't go down, it moves from background noise to something worth mentioning specifically by name at your next appointment. The eighth sign is unexplained weight loss, meaning your weight dropping in a noticeable way without you changing how you eat or how active you are. Sjogren's fatigue already makes appetite unpredictable for a lot of people, so this one is genuinely tricky to separate from your baseline. The distinguishing feature here is usually the amount and the speed, a meaningful drop over a few months that you can't otherwise explain, rather than the small day-to-day fluctuations most of us have. Alongside these, a low-grade fever that comes and goes without an infection to explain it rounds out this cluster. None of these three on their own are alarming. Together, or alongside a lump or persistent gland swelling, they're the kind of combination that deserves being said out loud to your rheumatologist in one sentence, not mentioned separately and forgotten. If any of these last two have been happening to you quietly, the night sweats you've been changing sheets over, the weight that slipped without explanation, I want you to know that these are easy to miss precisely because Sjogren's already makes your body feel unpredictable in 100 small ways. Noticing a real pattern inside all that noise takes a kind of attentiveness most people don't have to develop. Type the word tired in the comments if this is the cluster that's been quietly building for you. You don't need to have all the answers to deserve someone taking a closer look. Now let's talk about who inside the Sjogren's community carries a higher version of this risk, because it's not evenly distributed and knowing where you land helps you know how closely to watch. Persistent, one-sided swelling of the parotid gland is the single biggest flag. We already covered that. Swollen lymph nodes that don't resolve is another. An enlarged spleen, which you wouldn't necessarily feel yourself but that shows up on imaging, is a documented risk factor. Low complement levels, specifically something called low C4, which is a blood marker your rheumatologist tracks, correlates with higher risk, so if you've ever heard your doctor mention your complement levels being low, that's relevant context, not just a random lab value. Cryoglobulins, another blood marker some Sjogren's patients test positive for, raise the risk further. And simply having had Sjogren's activity that stays moderate to high for a long stretch of time, rather than mild and quiet, is associated with more risk than Sjogren's that stays gentle. None of these factors mean it's coming for you. They mean these are the categories your rheumatologist is already quietly watching if you fall into them, and now you know why, so you can ask better questions instead of wondering what all those labs are actually tracking. I want to give you something practical, because information without a next step just becomes anxiety with nowhere to go. Here is your 60-second Sjogren's mouth and neck check, something you can fold into the routine you already have, brushing your teeth, doing your dry mouth rinse, whatever your morning already looks like. Look inside your cheeks and along your gum line for anything white or red that wasn't there last week and hasn't gone away. Stick out your tongue and check both sides and the underside for a sore that's lasted more than 2 weeks, especially if it doesn't hurt. Run 2 fingers along your jawline in front of your ears and compare both sides for swelling that isn't matching your usual flare pattern, especially anything that feels firm or one-sided. Gently feel down both sides of your neck for anything new, any lump that wasn't there before. And just notice, does your voice sound like your voice today? Does swallowing feel like it normally does? Have you woken up soaked in sweat more nights than not lately? Has your weight shifted without an explanation? That's it. Under a minute, fold it into something you're already doing, and it becomes the difference between catching something early and finding it by accident 6 months later. I know this whole topic sits in a strange place. Sjogren's already asks so much of you every single day: the dryness, the fatigue, the joint pain, the being disbelieved by doctors who don't understand why you're this exhausted from something that just affects moisture. And now here I am adding one more thing to watch for. I get why that feels like too much some days. But I don't think of this as one more burden. I think of it as you finally being told the full truth about your own body instead of a partial one. You were already checking your mouth every day. You were already feeling your glands. All I'm doing is handing you the map for what you were already looking at, so that what used to feel like random Sjogren's noise now has a shape you can actually recognize. If any part of what I described today matched something you've been quietly noticing, type the word "seen" in the comments. Not because anything gets sent your way. Just because there's something powerful about naming the thing you've been carrying alone, out loud, even in a comment section. You are not being dramatic for paying attention to your own body. You are not overreacting by wanting an answer. You have been living inside this disease long enough to know your own baseline better than anyone else on earth, and that instinct, the one that noticed something was different, that instinct has always been worth trusting. Take care of yourself today. You are so much more than the thing you're managing.